Hello everyone, in this video we are going to use a few minutes to demonstrate how to insert the needle in your body and how to practice by yourself. So all what you need is a disinfectant. The disinfectant can be the surgical spirits or 75% alcohol. So the disinfectant and the needle. So the needle, normally these kinds of needle, also the needle we gave you, the needles we gave you are actually disposable, which means we only use once. But for the practical training, we can reuse them, providing that you use on yourself only. Which means if I use the needle on myself, I can reuse them. Just be careful when you reuse them. You need to disinfect. You need to clean the needle again before you reuse. Okay, so that's what you need to do. So we're going to demonstrate the insertion first. You take a needle out of the package. You're going to use the disinfectants. So I'm going to insert to this point. Do you remember what's the name of this point? Okay. We're also going to use the disinfectants to clean our fingers if we don't wear gloves, especially in our practical training, especially when you practice on yourself. We don't really use the gloves. So you're going to clean your fingers, you're going to clean the skin. Okay, you're going to use these two fingers to hold the needle. The middle fingers to attach to the tip of the needle. Okay, that's how you insert. As you press, the needle will go in, and then just keep pushing. You can use the tail of the needle. When you keep pressing the needle, you actually can feel when you insert the needle, you don't feel that much painful actually. So the technique here will require fast insertion, which means this movement should be fast. So once the needle goes in your body, you don't feel the pain, or you feel more like distending feeling. So when you practice, you need to try to feel what's your feeling from your fingers. So as I manipulate the needle, how do I feel from the finger? And also because you practice on yourself, so you also can feel how you feel under the skin. Okay. So that's all what you need to do. Pressing, and then afterwards you can remove the needle. Okay. So that's the insertion. If you can see some bleeding, you just need to press with a dry wool cotton. And that's all. If you want to reuse the needle, before you reuse, you need to clean the needle again. You either use the disinfectants to clean the needle, or you can put the needle in a pressure cooker for 30 minutes. That's also another way to clean the needle. So you can use again, providing you have cleaned them. When we clean our skin before the insertion, you use the wool cotton to clean your skin. You're going to clean from the center to the side. So you make a circle like this, from the center to the side. Once you reach the side, this wool cotton will never go back to the center. So from here, from center to the side. Okay, that's the direction. you will never go back to the center, because once you clean to the side, this wool cotton already have been polluted, or it is not as clean as before, so you will never go back to the center. And for the technique of cleaning the skin, we're going to clean from the acupoints to the side. For instance, if I want to insert these points, this is the large intestine points. I want to clean from the center to the side. From the center to the side. So you can try some points that are safe. The safe points, which means it's in your arms. If bleeding after you remove the needle, you just use the wool cotton to press. You don't need to stress if bleeding. Okay, thank you guys.